Hey everyone, welcome to The Explainer. Today we're embarking on a pretty structured journey to take high blood sugar from this sort of medical mystery to something you can absolutely master. Whether you're managing your own health, supporting a loved one, or honestly just curious about how the human body works, we're going to break down exactly what happens when those blood sugar levels climb a bit too high. To put this into perspective right out of the gate, about 1 in 10 people in the United States has diabetes. So this isn't some rare, obscure condition, right? It's incredibly common, and experiencing hyperglycemia episodes is just a shared reality for literally millions of people. If you're dealing with this, please know you are absolutely not alone, and just understanding the sheer scale of this really helps us approach it without any stigma. So here is our roadmap for today. We'll start by defining what high blood sugar actually is, look at the root causes, learn how to spot the symptoms, and cover the emergency warning signs of DKA. Finally, we'll wrap things up with diagnosis, treatment, and how to actually live well with diabetes. Okay, let's dive into this.
Section 1. What is high blood sugar? Defining the core concept.
The big medical term we're unpacking today is hyperglycemia. Let's break that down for a second. Hyper literally means above or beyond. It's the exact opposite of hypoglycemia, where hypo means below. So what exactly is going above normal here? Well, it's glucose. Glucose is the sugar that mainly comes from the carbohydrates in the food and drinks we consume, and it's your body's absolute primary source of energy. Your blood carries this glucose to all your cells. But when you have too little of a hormone called insulin, or your body just can't use that insulin properly, that glucose doesn't get used. It just builds up in your bloodstream. Think of this like your own personal reference guide. When you get fasting lab work done, meaning, you haven't eaten for at least 8 hours, a totally normal blood glucose level is less than 100 milligrams per deciliter. Prediabetes sits right there in the middle, between 100 and 125. And a fasting level greater than 125 on more than one occasion, that typically indicates diabetes. You're definitely going to want to keep these numbers in mind because they are the exact benchmarks healthcare providers use to keep you safe.
Moving right along to Section 2, the root causes, mechanics of the condition.
So the absolutely crucial point here is understanding the two main culprits, which basically come down to a classic lock and key mechanism. It's like a giant puzzle. Imagine your body cells are locked doors, and the glucose is the energy just waiting outside. Insulin is the key that unlocks those doors to let the energy in. Now, the first issue is insulin resistance. This is when the locks on your cells are basically jammed. The keys are there, but the cells just don't respond properly to the insulin, requiring your body to pump out more and more of it just to get the door open. The second issue is pancreas issues. In this scenario, your pancreas, which is the organ that actually makes the insulin, is damaged or under attack, meaning you simply don't have enough keys to begin with. Both of these scenarios leave all that sugar trapped right there in the bloodstream. Let's look at the specific triggers that cause these lock and key failures. Yes, genetics and autoimmune diseases like type 1 diabetes, where the immune system mistakenly attacks the pancreas, those play a massive role. But look at these other factors. Excess visceral fat, which is that fat around your belly and organs, is a huge primary driver of insulin resistance. A diet heavy in highly processed carbs, that completely taxes the system. And here is something really fascinating. Acute physical stress from an illness or even intense emotional stress causes your body to release cortisol. Cortisol is a stress hormone that actually raises your blood sugar temporarily. Even something as simple as taking the wrong dose of a prescribed diabetes medication can trigger a sudden high blood sugar episode.
Section 3. Spotting the symptoms. Early and long-term warning signs.
Interestingly enough, a lot of people don't feel any symptoms at all until their levels cross a threshold of around 250 milligrams per deciliter. When they do finally appear, they're essentially the body's emergency response system trying to flush out all that excess sugar. You might experience this intense, unquenchable thirst and find yourself needing to urinate constantly. That's just your kidneys working overtime to filter and absorb that extra glucose. You might also feel persistently hungry, because remember that lock and key analogy? If the sugar can't get into the cells, your body literally thinks it's starving for energy. You might also notice nagging headaches or suddenly blurred vision. Now, if high blood sugar is left untreated and becomes chronic, the symptoms definitely evolve. You might experience this profound, unexplained fatigue or even unintended weight loss. You might also notice frequent skin or yeast infections and find that simple cuts and scrapes take an unusually long time to heal. If this is allowed to persist for years, this chronic hyperglycemia can severely damage your blood vessels, leading to some really serious complications like neuropathy, kidney damage, and eye disease. Section 4, the danger of DKA, recognizing an emergency. We really have to ask this critical question. When does high blood sugar cross the line from a totally manageable condition into a life-threatening medical emergency? Well, this happens when a severe lack of insulin forces your body to break down fat for fuel at an alarming rate, which produces these toxic acids called ketones. This condition is called diabetes-related ketoacidosis, or DKA. These are the red flags of DKA, and honestly, they are not to be ignored. If you or a loved one experience high blood sugar accompanied by nausea, abdominal pain, and especially vomiting, it is an emergency. Other signs include severe dehydration, a really distinct fruity smell in the breath, and deep, labored breathing. This can rapidly progress to confusion or even a loss of consciousness. Let me be incredibly clear here. If these symptoms arise, do not wait. You must seek immediate emergency medical help. Section 5, Diagnosis and Treatment. Taking back control. Okay, while DKA is definitely frightening, the really good news here is we have so many empowering tools to take back control long before emergencies ever happen. Healthcare providers have a whole arsenal of tests to screen for and diagnose this. They might use a fasting glucose test or an A1C test, which looks at your average blood sugar over the past few months. For daily management, technology has completely revolutionized treatment. Continuous glucose monitors, or CGMs, can sit right on your arm and alert you to spikes in real time. But just a quick note on those. While CGMs are amazing, they can sometimes be inaccurate. Traditional finger prick glucose meters are still totally essential to verify your numbers if a CGM reading doesn't match how you're feeling physically. And this brilliantly illustrates the daily foundation of living safely with diabetes. It really just comes down to a structured routine. Step 1, taking your insulin or oral medications exactly as prescribed. Step 2, balancing your carbohydrate intake with regular exercise, which actually helps your cells become more sensitive to insulin. And step 3, consistently monitoring your levels so you can catch a spike early and adjust accordingly. It's really all about finding that steady balance. The golden benchmark you want to aim for is an A1C level below 7%. Studies show that hitting this target significantly reduces your risk of those long-term complications, like nerve and kidney damage. This is a highly tangible, actionable goal that you can discuss at your very next doctor's appointment. Section 6, Living Well with Diabetes. A note of encouragement. Receiving a diabetes diagnosis, or even just struggling to manage your numbers, it can feel incredibly overwhelming, and it's completely normal to feel frustrated. But I really want you to take this to heart. As the experts at the Cleveland Clinic remind us, it's important to remember that high blood sugar doesn't have to be chronic. Know that there are steps you can take to prevent it. You are not powerless here. Whether it's adjusting the timing of your meals, going for a brisk walk after eating, or communicating openly with your healthcare team when you feel overwhelmed, lifestyle adjustments genuinely work. There is an entire community and a medical framework designed specifically to support you. So, I'm going to leave you with this final thought to ponder. You don't have to change everything overnight. What is just one small adjustment you can make to your routine today to help bring your body back into balance? Maybe it's drinking an extra glass of water, maybe it's scheduling that overdue checkup, or maybe it's just paying a bit more attention to the hidden sugars in your pantry. Thank you so much for joining me on this explainer. Keep asking questions, keep learning, and here's to taking back control of your health.